Yes, CAR T treatments are really exciting. They're at the forefront of what's being studied in myeloma. They're not quite ready for prime time yet because we still don't know all about the safety or the durability of this treatment. But one of the exciting things is some of the CAR Ts are able to actually kill myeloma that's been really resistant, and we're seeing that in some of the early data presented about the patients who had relapsed and refractory myeloma. And this is really important because some of these patients have no other option. So to have something that really eradicates disease for some patients who were not able to get a response, that's really encouraging. But like I said before, it's a therapy that's not available to everyone just yet. It's still being studied, particularly for safety and now for efficacy. And once that data is more mature, and I would say that would be maybe in the next 1 to 2 years, we'll be able to better understand where to position that for our myeloma patients. We're looking at ways for myeloma to be attacked in a different, for example, using a different protein on the myeloma surface and tagging that with an antibody or making the antibodies work better. So for example, we could maybe activate a T cell and tag that and target it towards an antibody that's targeting a myeloma cell. We could bring the myeloma cell with the T cell together and make the patient's own immune system kill the myeloma better. Or maybe there could be some toxin attached to an antibody, and so when the antibody goes to the myeloma cell, it directly is toxic to that cell only. So you can get specific effects on the myeloma cell. So really targeting the myeloma cell itself with the immune system is some of the things that we're looking at. Some of the other exciting drugs are looking at different intracellular mechanisms, combining known ways of resistance and sort of unmasking ways to get around that with some intracellular small molecule inhibitors.